It's time for Science and Medicine, a collaboration between TPR and the UT Health Science Center San Antonio, where scientific discovery advances how medicine is practiced everywhere. I'm Bonnie Petrie. About a third of the people who have epilepsy don't respond to any of the nearly 20 medications available to treat the seizure disorder, says Dr. Charles Szabo, professor of neurology and chief of epilepsy at UT Health San Antonio.
Any new medication that has a new mechanism of action is highly desirable and, of course, may help us sort of reduce the number of people who may need to turn to other type of therapies.
Szabo is now studying one such medication, a new type of compound that seeks to ease what he calls brain excitability.
All of our neurons are, of course, excitable, fortunately, because that's how we can communicate, that's how we perceive things, that's how we can think. But when there's a little bit overexcitation, then you have more of the neurons sort of following the same drumbeat. And in that case, that's not very good because then they're not performing their functions anymore. They're actually being overridden by this drumbeat.
That, Szabo says, is the definition of a seizure, and the medication he's studying takes a different approach to calming overexcited neurons. It targets the potassium channel.
Traditionally, we've been dealing with mainly sodium and calcium channel blockers or medications that block neurotransmission, but this is a new approach.
Szabo says it is a hopeful time for people with epilepsy, which is often manageable now.
Many of the people who have epilepsy can have very normal lives.
That's Science and Medicine from the UT Health Science Center, San Antonio, and Texas Public Radio. I'm Bonnie Petrie.